Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Dermatology. Let's get started with question number 1. For the following case, which of the following is the most likely mechanism causing this patient's adverse reaction? A. IgE, dependent mast cell degranulation. B. IgE, independent mast cell degranulation. C. Inhibition of prostaglandin synthesis. D. Precipitation of immune complexes. E. T-cell release of inflammatory cytokines. The case scenario is: a 28-year-old woman is brought to the emergency department by her family due to acute left flank pain. The pain radiates to her groin and is associated with pink hematuria and urinary urgency. Past medical history is unremarkable, and the patient has never experienced similar symptoms. CT scan of the urinary system confirms the presence of a stone at the uretero-vesical junction. The patient is given intravenous morphine sulfate for pain relief. 15 minutes later, she develops diffuse itching involving the arms, legs, and back. The question is: which of the following is the most likely mechanism causing this patient's adverse reaction? Your options are: A. IgE, dependent mast cell degranulation. B. IgE, independent mast cell degranulation. C. Inhibition of prostaglandin synthesis. D. Precipitation of immune complexes. E. T-cell release of inflammatory cytokines. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is B, which is IgE, independent mast cell degranulation. This question is designed with the focus to assess your ability to apply foundational science concepts. This patient with acute pruritus following administration of morphine most likely has medication-induced IgE, independent mast cell activation. A number of medications, including opioids, radiocontrast agents, and some antibiotics, example, vancomycin, can induce mast cell degranulation. This results in release of several mediators, including histamine, bradykinin, heparin, and a number of enzymes and chemotactic factors. Common symptoms include diffuse itching and pain, bronchospasm, and localized swelling, or urticaria. If you choose any option other than B, you are wrong. Let's briefly discuss the other options. A. IgE, dependent mast cell degranulation. IgE-mediated degranulation is typically associated with environmental exposures such as foods or vespid stings, or with medications such as beta-lactam and sulfonamide antibiotics. Opioids can cause IgE-dependent degranulation, which is very rare, but IgE-independent reactions are more common. C. Inhibition of prostaglandin synthesis. Inhibition of cyclooxygenase 1 by aspirin and nonsteroidal anti-inflammatory drugs can trigger urticaria in patients with chronic idiopathic urticaria. These medications shunt arachidonic acid metabolites toward formation of leukotrienes, which increase vascular permeability. D. Precipitation of immune complexes. Serum sickness is a type 3 hypersensitivity reaction caused by precipitation of circulating immune complexes. Typical symptoms include fever, pruritic rash, and arthralgias starting 7 to 14 days after antigen exposure. Common triggers include beta-lactam and sulfonamide antibiotics. E. T-cell release of inflammatory cytokines. Acute allergic contact dermatitis is caused by a T-cell-mediated type 4, delayed, hypersensitivity reaction to an antigen on the skin surface. Gross findings include erythematous, papulovesicular, weeping lesions. Your take-home message from this question is that a number of medications, including opioids, radiocontrast agents, and some antibiotics, example, vancomycin, can trigger IgE-independent mast cell degranulation. Common symptoms include diffuse itching and pain, bronchospasm, and localized swelling, or urticaria. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.